In St. Louis, Missouri, they're back to indoor mask mandates today. In Louisiana, one of the largest hospitals is stopping non-emergency surgeries. A single county in central Florida is seeing 1,000 new COVID-19 cases a day now. Hospitals there are near capacity, the mayor saying they are in crisis mode. It's easy to remember the time when these kinds of headlines were routine, but it's unfathomable that we're back here again. With the highly contagious Delta variant on the rise, look at the far right of your screen. All 50 states in the country are experiencing a significant growth in COVID cases. In the last month, the rate of new cases per day has quadrupled nationwide. And that trajectory is, of course, fueled by the millions of Americans who remain unvaccinated. States have tried giving people free beer, free food, cold, hard cash as incentives to get the shot. Still, only 49% of the country is fully vaccinated against COVID, well below the threshold needed to achieve herd immunity. And so now, with crisis mode bearing down on us once again, some states are pulling out the last tool in their arsenal to try to curb the spread of COVID. We saw it for the first time last month when a hospital system in Houston, Texas, required all of its healthcare workers to get vaccinated if they wanted to keep their jobs. It was a little bumpy at first. More than 150 workers either quit or were fired for not complying. A group of them filed a lawsuit against the hospital. But since that, 98% of the employees at the hospital system have been fully vaccinated. 2% received exceptions or deferrals. And the judge in the lawsuit, she tossed out the case. She said the hospital was just, quote, trying to do their business of saving lives without giving patients the COVID-19 virus. Now, if you measure success here by how many people got vaccinated in the ecosystem of people working at this one hospital system, this worked. A 97% vaccination rate among a single group of people is probably higher than anywhere else in the world right now. And so now other people are running Houston's playbook. Today, both the city of New York and the entire state of California announced that they would require all their employees to either get the COVID vaccine or subject themselves to weekly testing. This new rule will apply to around 340,000 municipal workers in New York City, from teachers to police officers to government officials. In California, it applies to every state employee, roughly 250,000 people, plus 2 million on-site public and private healthcare workers in the state. The Department of Veterans Affairs also issued a vaccine requirement today for all its healthcare employees working in the VA health system. It applies to 115,000 frontline healthcare workers. It is the first vaccine mandate at the federal level in America. Just tonight, the Justice Department has issued an opinion that says federal law does not prohibit businesses or agencies from imposing COVID vaccine mandates. This may encourage more businesses across the country to issue these requirements. Get the shot or don't come to work. There's been a real flurry of action around mandating the COVID vaccine for certain slices of the population, and it is a trend that many medical professionals hope to continue. Today, nearly 60 different medical groups issued a joint statement calling for mandatory vaccine requirements for all healthcare workers in the United States. For many groups on the list, it was the first time they had made such a public endorsement of mandating vaccines, but their reasoning is clear. They write, quote, as the healthcare community leads the way in requiring vaccines for our employees, we hope all other employers across the country will follow our lead and implement effective policies to encourage vaccination. The health and safety of U.S. workers, families, communities, and the nation depends on it, end quote.